Hi, I'm Kelly Moriarty with Aspen University. I will be doing an assessment on Miss Jones. We'll go ahead and get started. Hi, Miss Jones. I'm Kelly. I will be examining you today.
Hey,
What brings you in today?
I came in because I'm required to have a recent physical exam for the health insurance at my new job.
Congratulations on your new job. That's very exciting.
Thanks.
We will go ahead and get started. Are you having pain anywhere today?
I don't have any pain anywhere.
Start with your vital signs. Blood pressure 128/82, heart rate 78, respiratory rate 15. Oxygen saturation is 99% on room air. Temperature is 37.2, which is about 98.9. Excellent vital signs. Your blood pressure is looking much better. Assess orientation. What is your name and date of birth?
My name is Tina Jones, and I was born on February 17th.
What building are you in now?
I'm at the doctor's office. It's Shadow Health General Clinic.
What is the date and year?
Today's date is...
Miss Jones is alert and oriented ×3. We will inspect her skin and just general musculoskeletal assessment. She does have some echinosis nigerans, or it's that darkness around her neck. More prevalent on the back of her neck, or the posterior area, and lateral. Get her torso. I see some stretch marks or striations, no obvious deformities or noted injuries. I'll check the hands. Skin appears to be intact also. She does have some hair growth at the umbilicus. A little bit of swelling on that right ankle there, the lateral area of the ankle. See it there. And lastly, we will inspect her feet. She has had previous foot injury. You can see some scarring here in the medial area of the right pedal, the right foot, excuse me. But skin is intact. No more signs of infection in that foot. We will now inspect her head. The acne looks to be getting better. Palpate sinuses for tenderness or irritation. The frontal sinuses, no pain reported. And the maxillary sinuses, no pain reported. Inspect her eyes. No redness or drainage. Conjunctiva is pink and moist. Her eyelids. Upper lids. Once again, no irritation there. Same with lower. No drainage or swelling. We will assess her eye movements. Neurological exam. Follow my finger with just your eyes.
Okay.
So we're checking extraocular eye movements and also convergence. And her extraocular eye movements and the convergence all seem to be intact. No eye deviations or anything like that. We will check her pupils for pupillary reflexes. And we will check both eyes so we can see both eyes are constricting. Both eyes are equal and reactive to light. So I would say pupils are 3, brisk reaction there. Inspect her ears. No drainage to the external otitis. Or, I'm sorry, she does not have otitis. No external otitis. And checking with the otoscope. Eardrum is pearly gray. Cone of light is there. Everything is intact in the right ear. Also in the left ear, it's the same. We'll check in her nares also while we're at it. No drainage, no swelling. It's pink and moist mucosa. Inspect her mouth and throat. Depress the tongue. Tonsils do not appear to be swollen. Her tongue and mucous membranes are all intact with, no open sores. Mucous membranes are pink and moist. And lastly, we will check her gag reflex, and that is intact also. Next, we'll palpate the thyroid, make sure there's no goiters or nodules while she takes a sip of water. And there are no nodules or goiters. The last part of the head and neck, we'll palpate for lymph nodes. So cervical lymph nodes and supraclavicular. See if any of them are palpable. If they are, we could follow up and make sure there's no illness or anything that could be causing that. No lymph nodes palpated. No tenderness per the patient. Next, we'll move on to inspecting the anterior chest. No lesions or deformities. We will now palpate the carotids, the carotid arteries, make sure we're getting good blood flow to the brain. +2, no thrill on the right, as well as the left. Next, we'll auscultate the heart. Not sure if my microphone's picking this up. Sounds like a regular rhythm. S1 and S2 noted. So normal heart rhythm there. She has not had any cardiac complaints. Next, we will auscultate the lungs. The lungs are clear and equal bilaterally. We will move on to the posterior chest now. And once again, inspect the posterior chest. No deformities or abnormalities. We will palpate for symmetrical expansion, so checking for the rise and fall of her breathing. And that is symmetric. You can see the hands moving up and down. We'll also auscultate her posterior chest for long sounds. Since she does have asthma, we want to make sure she's clear all over. Once again, she is clear bilaterally, equal and clear. We'll do a spirometry reading. She's had these in the past, and she will probably have them in the future due to her asthma. So it's good to keep an ongoing assessment of this. Blow into the spirometer. So you see her FVC and her FEV. We will record those, and that way we can compare in the future if she's not feeling well to monitor her asthma. Moving on to the abdominal assessment, we will inspect her abdomen. It is a little protruding there, rounded but not distended. First, we will auscultate after inspection. I don't want to drum up any bowel sounds that might not be there. So we start in the right lower quadrant, moving up to the right upper quadrant. Left upper. And she has bowel sounds in all 4 quadrants. Normal active bowel sounds. Next, we'll palpate the abdomen for masses and tenderness. Her belly is soft. No masses noted. We will also do some deep palpation. Once again, no tenderness and no masses in any of the quadrants of the abdomen, and we will palpate organs too. Right kidney, not palpable, no masses. Left kidney, not palpable, no masses. Check the spleen next. What should not be palpable, and it is not on this assessment. And lastly, the liver, if that's palpated. If anything is palpated, it's usually the liver, and that is palpable 1 centimeter below the right costal margin. Next, we'll check her upper extremities. We've inspected them already when we did the skin and muscle assessment. We'll check for pulses now. Her skin is, I'm assuming, warm and dry. Right brachial pulse is 2+. Right radial pulse is 2+. Left brachial is 2+. And the left radial is also 2+. She does have history of diabetes and hypertension, so it's important to monitor her peripheral blood flow. We will inspect her fingernails. There's no clubbing, no cyanosis. This time we could also check for cap refill. In adults, it's good to check pulses. So. We will check her motor skills. This is neurological testing here. Place your hands on your knees and turn them over.
Okay, like this?
Rapid alternating hand movements is intact, so her motor is intact. Oops, sorry. And we will check her deep tendon reflexes. Right tricep. Normal reflexes there, 2+. Right bicep. Also 2+. Brachioradial reflex. Intact. Now moving on to the left tricep and bicep. 2+. 2+. And brachioradial, 2+. And now we will move on to her lower extremities to conclude our assessment here. We will just inspect her legs for edema, especially given hypertension. No edema noted to bilateral legs. We will also palpate her lower extremity pulses, starting with the femoral arteries. 2+ for the right femoral, as well as the left. Moving on to the popliteal. Right and left are 2+. The posterior tibial pulses. Are both 2+. And then finally her dorsalis pedis pulses. This is important since she does have diabetes and has had foot injuries. We want to make sure she's getting proper blood flow to those feet to prevent injury and promote healing, and those are both 2+. We will also inspect her toenails. She has no clubbing, no rigidity, no cyanosis. Could check her capri fall at that time also. We will check her toe position just to see make sure there's no nervous system disorders and she has good feeling in her feet. Close your eyes and say if your toe moves up or down. Close your eyes and tell me if your toe moves up or down.
Okay, I will.
Right foot.
I think that was up.
Okay. So position sense on the right foot is intact.
Down.
And as well as the left. And lastly, we will do monofilament since she's had foot injuries before. Close your eyes and tell me when you feel the touch.
Okay, I will. Yes.
Okay.
Yes.
So she has decreased sensation in the right great toe and the right lateral aspect, lateral aspect of her foot. Let's check the left.
Yes.
And she also has decreased sensation on the left great toe, the left medial and lateral aspects of the foot, which is something that we'll need to monitor due to her diabetes. That will conclude our assessment for right now. It is kind of difficult to get a full assessment in 20 minutes, which is the average office time for patients. So this was definitely a really good project. Thank you, and thank you, Mrs. Jones.